Have you ever wondered how medical professionals assess and manage patients with confusion or a decreased level of consciousness? It's a question that many of us may have pondered, especially when it comes to understanding the intricate workings of the human mind. This topic holds immense significance in the field of medicine, as it often presents a challenge to even the most seasoned practitioners. In this video, we'll be exploring this intriguing subject in depth, touching upon its various aspects such as the basic understanding, diagnosis, management, and real-life case studies. We'll be delving into the science behind these conditions, the common causes, and the most effective interventions. So, whether you're a curious mind seeking knowledge or a budding medical professional eager to learn, this video will provide you with a comprehensive overview of this complex topic. If you're ready to dive deeper into this fascinating topic, stick around. To get started, it's crucial to understand what we mean by confusion and decreased level of consciousness. So let's break it down. When we talk about confusion, we're referring to a state where a person has trouble thinking clearly and making sense of their environment. They may struggle to remember recent events, be unable to recognize familiar places or people, or exhibit erratic behavior. It's like trying to find your way through a dense fog, where things are unclear and disorienting. Now, on the other hand, when we say decreased level of consciousness, we're talking about a more serious condition. This is when a person is not fully alert or aware of what's happening around them. They may not respond to stimuli in a normal way, or they may not respond at all. It can range from mild drowsiness to complete unconsciousness. Imagine being in a deep sleep, where you're oblivious to the outside world. That's a form of decreased consciousness. It's important to understand that while confusion and decreased consciousness may seem similar, they are distinct conditions. Confusion is more about a lack of clarity in thought processes, while decreased consciousness refers to a diminished awareness of the environment. Think of it this way: a confused person may not remember their name, but they're still awake and aware that they're in a conversation. A person with decreased consciousness, however, might not even realize they're being spoken to. Furthermore, these conditions can occur independently or together. A person can be confused without having a decreased level of consciousness. Similarly, a person can have a decreased level of consciousness without being confused. However, when they occur together, it typically indicates a more serious underlying condition that requires immediate medical attention. Now that we've got the basics down, it's time to explore how these conditions are diagnosed. Diagnosing confusion or a decreased level of consciousness isn't always straightforward, but there are some key methods professionals use. When it comes to diagnosing the cause of someone's confusion or decreased consciousness, the first step is typically to take a thorough medical history. This involves asking the patient or their caregiver about any existing medical conditions, medications they might be taking, and the timeline of their symptoms. It's important to get as detailed a picture as possible, because even seemingly minor details can sometimes hold the key to understanding what's going on. Next, a comprehensive physical examination is performed. This is where the healthcare provider checks vital signs like blood pressure, heart rate, and temperature, as well as other physical indicators. They will also evaluate the patient's mental status, looking for signs of confusion, disorientation, or other cognitive impairments. The physical examination can provide valuable clues about the cause of the patient's symptoms, and in some cases, it might even reveal a previously undiagnosed medical condition. Now, if the cause of the symptoms is still unclear after the medical history and physical examination, additional tests may be necessary. These could include blood tests to check for things like infection, electrolyte imbalances, or organ dysfunction. Imaging studies, such as a CT scan or MRI, might be ordered to look for structural abnormalities in the brain. In some cases, a lumbar puncture might be performed to analyze the cerebrospinal fluid, which can help diagnose conditions like meningitis or subarachnoid hemorrhage. One important thing to remember is that diagnosing these kinds of conditions is often a process of elimination. There's no single test that can definitively determine the cause of confusion or decreased consciousness. Instead, healthcare providers must systematically rule out potential causes until they arrive at a diagnosis. Another crucial aspect of the diagnostic process is monitoring the patient's condition over time. Symptoms can change, and sometimes new symptoms can emerge that provide additional insight into the underlying cause. This is why it's so important for patients and their caregivers to maintain open lines of communication with their healthcare providers and to report any changes in symptoms promptly and accurately. It's also worth noting that, in some cases, a cause may not be immediately identifiable. This can be frustrating for patients and their loved ones. But it's important to remember that medicine is as much an art as it is a science. Sometimes, the best course of action is to manage the symptoms while continuing to investigate the underlying cause. The goal of all these diagnostic methods is to determine the cause of the patient's symptoms so that an effective treatment plan can be developed. The sooner a diagnosis is made, the sooner treatment can begin, which can significantly improve the patient's prognosis. With a diagnosis in hand, the next step is managing the patient's condition. Managing a patient with confusion or decreased consciousness requires a multifaceted approach. It's about understanding the individual needs of each patient and tailoring the treatment plan to fit those needs. Let's talk about the main methods for managing these conditions. These methods include medical treatment, physical intervention, and psychological support. Each of these components plays a vital role in patient care, and they all work in tandem to ensure the best possible outcome. Firstly, medical treatment. This is often the first line of defense in managing confusion or decreased consciousness. Depending on the underlying cause, this could involve administering medication to control symptoms, treat infections, or manage underlying health conditions. For instance, if a patient's confusion is due to a urinary tract infection, antibiotics would be prescribed to clear up the infection. If the confusion is due to low blood sugar in a diabetic patient, then appropriate measures would be taken to stabilize their sugar levels. Next, we have physical intervention. This can be as simple as making sure the patient is comfortable and safe. In some cases, it may involve physical therapy or occupational therapy. For example, if a patient's decreased level of consciousness is due to a stroke, physical therapy might be used to help regain mobility and strength. On the other hand, occupational therapy could be utilized to assist the patient in relearning essential daily tasks. Lastly, but certainly not least, is psychological support. This is an often overlooked yet crucial part of managing these conditions. Psychological support can help patients better understand their condition, manage their symptoms, and cope with the emotional toll that confusion or decreased consciousness can take. This can involve counseling or therapy, support groups, or even simply providing a listening ear. This aspect of treatment is not just for the patient, but also for their loved ones who may be struggling to cope. It's important to note that these methods are not one-size-fits-all. Each patient's treatment plan will be different, depending on their specific needs and the underlying cause of their confusion or decreased consciousness. For some, medication may be the most effective method of treatment. For others, physical therapy or psychological support may play a more significant role. What's more, managing these conditions is not a linear process. It's not uncommon for patients' needs to change over time, requiring adjustments to their treatment plans. It's about being flexible and adaptive, always keeping the patient's best interests at heart. While managing these conditions can be challenging, it's important to remember that every patient's journey is unique. It's about meeting patients where they are, understanding their needs, and working together to find the best path forward. It's about providing compassionate care and support every step of the way. To bring these concepts to life, consider the following real-life case studies. These narratives will allow us to dive deeper into the complexities of diagnosing and managing confusion or decreased levels of consciousness. Our first case study introduces us to Mary, a 75-year-old woman who was brought to the hospital by her daughter. Mary was experiencing bouts of confusion and disorientation. She was forgetting recent events and sometimes didn't recognize her own daughter. After a thorough examination, it was discovered that Mary was suffering from a urinary tract infection, which had led to a condition known as delirium. Delirium, as we've discussed, is an acute state of confusion that can be caused by underlying medical conditions. Mary's case underscores the importance of a comprehensive medical examination in identifying the underlying causes of confusion. Next, we turn to John, a 50-year-old man who was found unconscious in his living room by his wife. John had a history of diabetes, but he was generally in good health. Upon arrival at the hospital, doctors discovered that John's blood sugar levels were dangerously low, leading to a state of decreased consciousness. This case highlights the role that chronic conditions like diabetes can play in causing sudden changes in consciousness levels. It also emphasizes the need for regular monitoring and management of these conditions to prevent such incidents. Our third case study is about Emily, a 20-year-old college student who started experiencing episodes of confusion and memory loss. After several tests, it was determined that Emily was suffering from a rare condition known as transient global amnesia. This case study shows us that confusion and decreased levels of consciousness are not always linked to age or chronic conditions. It can also be a symptom of less common conditions, which can be challenging to diagnose. Last, we have the case of David, a 60-year-old man who was experiencing episodes of confusion and memory loss. After a series of tests, it was discovered that David had early-onset Alzheimer's, a form of dementia. This case illustrates how confusion and memory loss can be early signs of more serious neurological conditions like Alzheimer's. Each of these case studies provides a unique perspective on the many factors that can contribute to confusion or decreased levels of consciousness. They highlight the importance of a thorough examination and the need for personalized treatment plans that address the underlying causes of these symptoms. In Mary's case, treating the urinary tract infection helped resolve her delirium. For John, managing his diabetes and maintaining a healthy blood sugar level prevented further episodes of unconsciousness. Emily's condition required careful monitoring, but her symptoms gradually improved over time. And for David, early diagnosis allowed for the implementation of treatments that could slow the progression of Alzheimer's. These case studies highlight the complexity and individuality of each patient's experience. Now that we've covered the basics, let's summarize what we've learned today. Confusion and decreased level of consciousness are significant issues in healthcare that often signal underlying conditions needing immediate attention. Confusion is a state where a person has trouble making sense of the world around them, while a decreased level of consciousness refers to anything from slight drowsiness to complete unconsciousness. These conditions are not diseases themselves, but symptoms that can be triggered by a myriad of medical problems. Understanding these symptoms and their possible causes is crucial. The causes can range from simple fatigue or dehydration to severe conditions like stroke, brain injury, or a systemic infection. These symptoms could also be side effects of certain medications or the result of substance abuse. Diagnosing these conditions requires a comprehensive approach. A medical history and physical examination are the first steps, followed by further diagnostic tests. These could include blood tests, imaging studies like CT scans or MRIs, or even more specialized tests like electroencephalograms. The goal is to identify the root cause, which can then guide the treatment plan. When it comes to managing these conditions, the approach is twofold. First, immediate measures are taken to ensure the patient's safety and stabilize their condition. This might involve providing supplemental oxygen, ensuring they're hydrated, or initiating other life-saving interventions. The second part of the strategy is to treat the underlying cause. This could mean adjusting medications, treating infections, or addressing any other identified issues. We also delved into a few case studies, each illustrating different scenarios where patients presented with confusion or a decreased level of consciousness. These cases highlighted how the cause can vary widely and how important it is to conduct a thorough investigation. They also showed how individualized the management strategies can be, based on the specific needs and circumstances of each patient. In conclusion, dealing with confusion and decreased levels of consciousness can be a challenge. These conditions require not only an understanding of the symptoms, but also an ability to recognize the potential causes and apply appropriate diagnostic methods. Management of these conditions is multifaceted, involving immediate stabilization and ongoing treatment of the root cause. It's a complex process that requires knowledge, skill, and practice. So whether you're a seasoned healthcare professional or a medical student just starting your journey, it's essential to continue learning and refining your skills. Because at the end of the day, it's all about providing the best possible care for our patients. Remember, understanding and managing confusion and decreased level of consciousness is a complex process, but with knowledge and practice, you can master these skills. Thank you for watching, and don't forget to subscribe for more educational content.